Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about burning pain that you can experience after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button if you don't already, and be sure to follow along and catch all of our videos related to knee replacement surgery. So when someone talks about burning pain, they may also describe it as hot or warmth. And this is a common sensation, a common type of pain to feel after having your knee replacement surgery, or really after any type of knee surgery. And there's a couple different reasons and a couple different potential causes for this. So one thing is possibly it's due to irritation or some pinching or compression of the nerves that travel around and through your knee joint. And that burning pain can be just that irritation or that compression of that nerve and that inflammation of that nerve. And that's really common. It might be accompanied by some pins and needles sensation, a little bit of numbness even a little bit. Another thing that it could possibly be is just the inflammation. One of the common characteristics of inflammation and swelling is warmth and heat. So you could feel that sensation of warmth and heat, and maybe you might describe it as burning just from the inflammation itself and the swelling itself after having knee replacement surgery. So it's probably a combination of both of them for most people, is that there might be some irritation to those nerves just from the trauma of the surgery itself, from the increased swelling and increased fluid in that area can cause some compression, can cause some irritation to the nerves around the knee joint. And of course, inflammation and swelling itself can have that burning, warm sensation. So first thing to keep in mind is this is a really normal thing. Not everyone is going to experience this burning pain after having a knee replacement, but many people are. So it is a common thing to experience after surgery. What it's also to keep in mind is that it can be managed, and usually the best healer, the best way to get over it, is just going to be giving it time. So going through the rehab process, going through the recovery as your body heals and you build up your strength and your range of motion, as your swelling starts to go down, as your body goes into the next phases of healing. After that acute phase, it's more of the kind of the laying down new tissues and remodeling and reconstructing itself. Then the swelling and the inflammation is going to go down, and probably some of that burning discomfort usually decreases slowly over time. What can you do to manage it in the meantime is managing your swelling is one big way. So using ice, you can also use compression and elevating the leg throughout the day above the level of your heart, and allowing that fluid to come out and kind of decrease some of that compression and irritation on those nerves and other soft tissue around your knee joint. You can also talk about with your doctor the potential for some type of anti-inflammatory to help decrease that swelling and decrease that inflammation even more. Don't take anything without consulting with your doctor, just because you're probably taking some other medications and you want to make sure that you're taking things appropriately. And just some gentle movement. I think as people get into the rehab and recovery, you start to bend and straighten your knee more, you start to walk a little bit more, start to do a little bit more activity. That's going to start to pump fluid out, that's going to start to calm down and desensitize some of those nerves and your central nervous system around your leg and your knee, and it's just going to feel better and better slowly over time. So the main thing is give it time. You can take some active steps to manage it, but realize that it's a normal thing to experience after surgery, and for the vast majority of folks, it starts to subside over time, little by little, and you'll feel a lot better in a few weeks. Maybe it might take a little bit longer, maybe a few months, but eventually you'll feel a lot better for the vast majority of folks. I hope you found this video insightful. Please, if you have any questions, leave them below. Hit that like button to help spread this video and help promote the channel to viewers like you. Thank you very much for watching.